Thank you so much for coming. So, anybody is doing meditation right now here?
Every now and then, not consistent.
Who else? You? You? Good. So that's good. So we have a lot of people that they don't know what meditation is. Do anybody knows what meditation is? Of course, the ones that they do probably not, right? Okay, so we're going to talk about meditation today. How did that work? This one? Oh, yeah. So we're going to talk about mindfulness meditation today. When we talk about mindfulness meditation, a lot of people obviously have that imagination that this is about a monk that isolated himself from the society and then sits in a dark room and sits quiet for hours and hours and hours and make it sounds, right? So, or some people think that obviously because of the origin of the mindfulness meditation or actually meditation, some people think it has some sort of a spiritual or religious background, and because of that, that might not be appropriate for some of us. But in reality, the way I look at it, mindfulness meditation is as a mental training. It's something that helps your brain to grow, and it's really appropriate for all of us to do, regardless of who we are, what type of religious we have. And it's like an exercise. And what that does, I can show you later, that it's been proven by scientific studies and research that it really helps for our mental well-being and also improves our resilience. And you know, resilience we talked about last time is about the coping against the problems and pain and suffering. So this is my brain, right? This is my mind, and it's probably all of you, right? Every day when we wake up with a lot of things in our mind. You know, we worry and daydreaming, ruminating, we remembering things, we planning, we disliking other things or people. And then also our brain is built in with emotions. Okay, this is something that we're born with, emotions. And a lot of times it's whether negative or positive emotions, but our mind has a default state, and that default state is always negative. We always think negative about things. And it's actually correct, because if you think about that, the emotions is built in to us for our survival. So everything that we look, we want to make sure that it doesn't bother us, it doesn't hurt us, it doesn't kill us, we are safe. So that's why we have all these negative emotions. So it's not always bad. You remember last time we said that stress is not always bad? So same thing as fear. If we didn't have fear of fire, we would burn, right? So that some of these emotions are important, but unfortunately, negative emotions are extremely sticky in our brain. When we feel upset, we feel upset for a whole day or a long time. And then we also have positive emotions, the emotions of love, emotions of friendship and, you know, joy. And those things, unfortunately, are very, very slippery in our mind. And sometimes you have to work hard to feel that positive emotions. We also have that mind wandering every day. It's so hard for us to focus, pay attention to things. And our mind has this tendency to wander around, okay? To drift away. And And this is something that is inside our mind. Our mind is not designed to automatically pay attention and focus. So we have to work hard in order to focus on something and pay attention to something. I want to go over that stress again that we talked about last time, because it's absolutely understanding that concept helps you to understand why meditation is important for us to do. Remember, the stress was an individual perception of a physical, mental, or emotional stimulus as a challenging, threatening, or overwhelming event when it exceeds our available coping resources, right? So when the stress starts coming to us, when we encounter stress, whether it's visual or tactile or by hearing, it goes into our brain, and the first thing it goes into the thalamus. The thalamus is like a rotor of our computer. It's like a gatekeeper. It processes and organizes these information that comes to us. And then, very quickly, it goes into the amygdala. Amygdala is that little thing inside our limbic system that was responsible to control our emotion and our stress and our fear. And what that does is quickly respond to the brainstem, to our hypothalamus and then adrenal gland, and produce adrenaline and the stress hormones, right? So it starts the stress response. And that short way is called short road, okay? That short road is very quick. So that's why when the car comes in towards us very fast, we don't have to think about it, that this is dangerous for us. It quickly appraise it, process it, and then we respond to it, right? If somebody hit us inside our face, we quickly, whether dunk or we hit back, right? We don't think about that moment. So that's a short road. But also, thalamus has the ability to send those information to a higher area of our cortex, which is to the appropriate area, visual or auditory cortex, and then it again reappraise that information. And then it sends that information again back into front of our brain, which is called prefrontal region. And then in the prefrontal region, that's the one that evaluate and process that information in a more intellectual, more wise manner. Then it sends the information back to the amygdala. Whether it cools it down, it says, okay, you're safe. The car is not coming towards you. Or they're not shouting out at you. It cools it down and it calms you down. Or sometimes it's a true story, it's an earthquake, you gotta run. So your brain tells you to do the right thing. Right? So it basically modulates your emotional response. Okay? I worked so hard to create this.
It's beautiful.
Yeah. So that's exactly, you can see the relationship of these area, how when the sensory input comes into the thalamus, goes to the amygdala, and then you get directly response, or it goes back into the cerebellum cortex. So what again happens when you get encountered with the stimulus is that your brain senses, processes, and appraises. And then we have a very, very rudimentary, preliminary appraisal here, and then you have a more intelligent appraisal in the prefrontal region, okay? But this perception of the problem of the stimulus, it's all related to our priorities, our experiences, our values, okay? If I'm a person that have a history with a dog that bite me and at some point, I'm going to be afraid of a dog bite. And when the dog comes in, I'm going to be very, very afraid. But if somebody loves dog and they train dog and they have 10 dogs at home, of course when they see a dog, they have a different response. So those priorities that we have, those experiences, the values that we have, absolutely affect how we appraise those stimulus in our brain. Now, however we do something, whether with exercises, whether with thinking, with practice, however we're able to change this area, how we appraise it, if we change our values and goals and experiences, however we be able to change that, we be able to change our emotion, how we feel about that stimulus. And that's a scientific way to do it. Now, you remember last time I introduced you 10 ways to cope. So all of those are based on that concept, to make some changes in how we perceive and cope with the stress, right? You remember about reframing our mindset, and then command your inner conversation. We talked about pausing. Pausing allows the prefrontal to kick in, does not allow that rudimentary short road of a stress response to activate. We have acceptance and let go of things that we can't do anything about. And then discover and accentuate the positive side of events is when, if we understand that we are negative and we are negative towards things, if you think about it, and as I said before last time, in every sad story lies a positive one. So we try to look at that positive inside of that negative and then accentuate that. That will decrease how bad and high stress we feel. Then sharing and storytelling. And then we had to talk about the gratitude. And again, the practice of essence of humanity. And that's so important, in my opinion, in our profession. And then practicing mindfulness meditation, and then personal health and wellness. Now, today, we're going to talk about mindfulness meditation. So that's one of the coping mechanisms that we talked about. But what is the mindfulness? So, mindfulness is the desire to be present fully and paying attention entirely in the present moment with curiosity, acceptance, and no judgment. Now, there are 4 main elements in being mindful. And number 1 is the desire, is your intention. Again, our brain, the default mode of our brain is to wander around. That's why we have so much ADHD and ADD right now. Because it's not that we have a new disease among us. It's just that we have this default mode in our brain, that our brain wanders around. And that's exactly, again, goes back to our survival. Because our brain is designed to scan every few seconds. Our eyes move 3 to 4 times every second. It gets information from different areas. Okay? And that's exactly designed for us to take care of ourselves, to save ourselves, to be able to survive. Right? So, and then also, our mind wanders around. We think about the future. We anticipate. We worry about things. If you look at me this way, I may feel like, okay, you're planning something for me. I hope it's a good one. But those are the things that we do that every day, every moment of our lives. So paying attention requires intention. It requires desire. Okay? Just like the last time I said, when you're in the exam is the most important exam. It changes your life. You can go to a better school if you do the right exam. And then when you sit there and look at that person, and the guy has a sandwich, eating sandwich inside of the exam, and you know that his brain is not there. It's not focusing. Or when I'm in the operating room and I'm operating, and my assistant thinking about the lunch at that moment, that my focus and her focus has to be 100% on that patient. It absolutely means that her brain is wandering around, right? So in order to be mindful, we have to have the intention. We have to work. We have to have the desire. And then to be present. Again, our brain loves to travel. It's called mind travel. Thinking about the past. What happened last night? What happened yesterday? What is going to happen in the future? Entirely in the present moment with curiosity and acceptance. And what that means is that our attitude about life. It's about the attitude of ourselves in towards the things that we see every day and experience. And if we have that attitude that we are curious to get engaged with the things that is coming towards us, then we can be mindful. And then no judgment. That's so important, because we are people who judge everything and everyone. Judgment is not bad. We need to judge. Again, judgment is another faculty of our brains to help us to survive. Because if we don't able to judge, then we can get into trouble. Right? People can set us up and get into trouble. So we have to judge. But being mindful, you have to minimize your judgment about the things. And medicine, in my opinion, is the best place to be mindful because of our profession, the people that we take care of. And mindfulness in medicine is, in my opinion, is awareness and compassion towards ourselves and our patients. It enables us to see the world from different point of view, have intense desire to engage, understand and accept the stress, the struggle and pain and suffering of us and our patients with open-heartedness without judgment. This way of being allows us to see our thoughts and behaviors more clearly, to pause and act wisely to shape an amazing quality within us to cope and establish peace with our pain and struggles, and to foster more compassion, care, and kindness within us and with our patients. So mindfulness has a different meaning when it comes to medicine. So in medicine, we deal with pain and suffering all the time. We deal with the negativity all the time. So we really have to open our arms and embrace these struggles and engage with them, not as really pain, but just as actually getting involved with helping other people and being more curious and have that attitude. And no judgment is so incredibly important in our profession. So mindfulness meditation is about changing our brain. It's a practice, right? We talk about it. The base and foundation of mindfulness meditation is neuroplasticity. It's being able to change our brain. It's the exercise that we do, and you can do it every day, you can do it 3 times a day. But what that does is changes your brain in a different way. Whether it increases the neurons in your brain, like in hippocampus has been shown that it's increased the neurons in hippocampus, and also it can increase the connections and the circuits that we have in our brain. We have almost 100 billion neurons in our brain. And every neuron has more than 10,000 connections. And all of these connections you are able to change with practice. And this is not new. If you think about that, when you play piano, after you practice for a long time, you see people play piano so beautifully. These hands are moving without looking at the notes. And that's because they change their brain. They be able to change the circuit. They strengthen those circuits. So mindfulness does the same thing. And the whole idea about mindfulness is paying attention. And that allows by paying attention and practicing to pay attention, you strengthen some circuits in your brain that allows you to be a better person, to be more mindful. And remember this picture? We talked about the prefrontal area, and that's the most important area that separates us from other species. And we have to really be proud of it. I'm proud of it, because it's very connected. You can see the connection with the limbic system. And that limbic system is the one that controls your emotion. So if you, for some practice, you be able to strengthen this part of your brain, you definitely have a better handle on your emotions. And this prefrontal region has a different areas. One of them is the lateral prefrontal area, which is located in this area. And that's the main area of our attention. That's the main area of our attention. So while practicing attention, focusing, you basically strengthen this part of your brain, which is part of your prefrontal. And then there's another part of the prefrontal region, which is called ventromedial, which is inside in the front. And that's very close to the limbic system right here. And that's the one that controls your emotions. So by improving that circuit, by increasing the connections, you'll be able to improve that that part of your brain, that CEO of your brain, the part that gives you the character, make you human, the part that helps you to be more intelligent socially. Okay, it does everything for us that changes us as a human being. And the ones that helps you to control your emotions are all located in that area. And again, you remember last time we said attention. Attention is the one that you can work on and practice to improve the others. So mindfulness meditation is paying attention on purpose in the present moment with no judgment. Every time you talk about mindfulness meditation, you have to talk about Dr. John Kabat-Zinn. He's the PhD researcher, writer, writer who actually works, I think, in Massachusetts, and he's the one that has been working on mindfulness meditation for years and worked with a lot of patients and all of these companies, and this is the definition that he came up with mindfulness meditation: paying attention on purpose in the present moment with no judgment. So it's about understanding that we have our mind wandering and mind travel, right? So we are trying in the mindfulness meditation to understand that and then redirect our attention back to our sensation. That's exactly what we do in mindfulness meditation. So it's like an attention training, in my opinion, okay? Which will be all of us, just imagine if we have the society, even tiny society, whether at work, at school, at home even, that we were able to have this desire to pay attention to that moment, to the task that we do, with attitude of curiosity and no judgment. Just imagine what would happen to us. I mean, if you practice this in every task you do, getting a master or trying to be a good physician, just imagine if you do, just follow these directions, you are going to be absolutely successful. And that environment would be a magical environment. And that's one of the problems that we have right now in our society. And it's not just because of us, it's because of everything, the culture. The culture of indifference, when we talk about culture of indifference, is because of all of these stimulus that comes to us to make us wander around and not paying attention to our tasks. So that's what the study shows, that with mindfulness meditation, your attention area and the prefrontal area will activate. And that's been shown with the MRI, functional MRI and the other studies. There are other studies about different type of mechanisms of mindfulness meditation, but I'm not going to go through that. We don't have time. But it's been definitely shown over the last 20 years. There's so many research that we can study. There's so many grants that have been given to people to study these things, and it's just sometimes it's magical when you read about it and you see how powerful they are. Now, we're going to go very quickly over this. I don't want you to remember this. It's just that it's been shown by literature that it helps us for our physical health, and it's been shown in people who had fibromyalgia, chronic pain, people who had chronic insomnia, and people with a heart disease. It decreased their anxiety and also helped them to cope with this problem. It decreased their pain, and the response to the appropriate medication were much higher. It helps your mental health. It's been shown again with multiple studies that it decreases and reduces your anxiety. It really helps for people who have depression. It actually decreases the risk of recurrence of the depression or relapse of the depression in the depressed patients. And also, one of the other important things is it decreases the relapse of the people who have substance abuse. And the cognitive function that is very important to me is that it improves your prefrontal area. So by that, it helps significantly to cultivate positive attitude and to the perceived stress. It facilitates a sustained attention. It helps you to be able to focus on different things during the day because it improves your attention center and increase your openness and extroversion, reduces negative emotions and worrying, and promote emotional stability. Now, what is mindfulness other than all of those studies and research and everything else to me? I've been doing mindfulness meditation more than 1 year. I actually exposed to meditation when I was 18. It was after I finished my high school, and I had a chance before I go to medical school, and I didn't know what to do. And one of the things that was I was curious about different things. So I went to a class and I started getting trained for meditation. And that meditation was different. I did for 1 year, but it was a different meditation. And there are a lot of different meditations if you think about that and read about that. That was about having a mantra, saying a word that doesn't have any meaning in your brain, trying to get rid of all of those worrying and thoughts in your brain, and then trying to calm down and possibly rest your brain. That was a concept. But mindfulness meditation is very different. And I think with studying a lot of these different type of meditation, I think that's the best one. And I think it's the second most common meditation that people do in the United States at least. So it's basically what that does, it directs our attention to our bodily sensation. So what you try to focus on some sort of a sensation that you have. Some people, this is called formal mindfulness meditation. Some people focus on their breath. They focus on their breath. So when their mind wanders and go different places, they redirect their attention back to their breath. Some people focus on scanning their body, focusing on different locations and of their body, from the toes to the top, or from the top to the bottom, it doesn't matter. From the left to the right, and their focus, every time they wander, the brain wanders, it goes back again, and they redirect their attention back into that sensation. And sometimes, some people do a mixture. That's what I do. I do the mixture of, I don't scan, I do mixture of sensation. Sometimes I focus on the sound. That's like a humming sound of the air conditioner, or the sound of the water. Or sometimes you can redirect your attention back to your sensation of one place. You don't necessarily need to scan it. But it's essentially attention to your bodily sensation. And then when your mind wanders, then you redirect your attention back again. And you do that over and over and over. And by doing that, you basically, again, practicing those circuits in your brain. And what that does is essentially like you stepping out of your mind. You're looking at your thoughts, your emotions, and your sensations. And you're staying quiet, and you're listening to what's going on at that moment. And when mind wanders, when you talk about the other meditation type that you try to get rid of those thoughts, those emotions, in mindfulness meditation, you allow them to come. You acknowledge them. You let them play in your front yard. It looks like you're standing behind the window and watching your yard, your backyard. And these emotions and thoughts, they come, they play, and they leave. You let them go. But the most important thing is that you don't judge them. You don't get involved with those thoughts. When the thoughts comes in, when the thoughts that are about past, future, anticipation, liking or disliking, when it comes, you don't want to latch on them. You don't want to think about those thoughts. Because if you start thinking, that's not a mindfulness meditation. You have to just allow them to come to you and let go. And when you let go, you redirect your attention back to your sensation. And your brain, after a while, when you practice this, your brain allows you to do that. And sometimes I feel like I wanted to let these thoughts to come to me. I wanted to see what's going on. And then I redirect my attention again. So it's not about quieting your mind. It's not a rest. You're actually exercising your brain. Okay? But it doesn't mean that with mindfulness meditation you decrease the pain. It has nothing to do with that. You actually allow those thoughts to come in, with those pain and discomfort to come in. But then it looks like you make peace with those thoughts, with those pain. And don't laugh, but that sometimes I do. People do that. They focus on their areas of their pain. You know, when your back hurts, when your neck hurts, when your knees hurting and swelling, you can focus on that. And that allows you to make peace with that discomfort. So yes, to me, it's like that guy that is inside the incredibly hard ocean with the tornadoes and the huge waves that come into you. But in mindful meditation, it looks like you're stepping out of that turmoil. You're stepping out and looking at that turmoil with calmness. And again, it allows you to see your mind more clearly. And it's amazing that after a while, when you practice this, it makes you different. When you deal with people that they're not good with you, for example, and they're harsh with you, you feel that harshness, but you recover faster. It doesn't hurt you as much. It gives you a peace. So, to me, it's like a special way of awareness. It allows us to know ourselves, our emotional resources and coping resources that we have. It definitely gives you a little mind stability. You don't jump around when hardness and difficulty starts, when the struggle comes. And then, to me, it makes you more resilient, makes you see better, and then also have a better appreciation of the world around you. And at the end, I think it allows you to be more grateful. And that's what you reach. You reach to serenity. I think it's a peace. And that's not going to be permanent. It requires a practice. So when I talk to my wife about this, she says, listen, it looks like you have to work every day. Again, we're trying to calm down, you're trying to work again. Yes, for calming down, you got to pay attention and you have to work. It's a constant work that we have to do. So, mindfulness meditation, yes, in medicine it will help your mental well-being and resilience. And I wanted to offer or recommend to every hospital and administration that just like the time we have for lunchtime, 1 hour, whatever, half an hour lunchtime, and then we have this 10 minutes break time, I definitely think every institution, and there are institutions, by the way, that currently have, but in medical profession, we also have to have a reflection time, a 15 minutes reflection time. That as a health professional, that we come into this very hard work, extremely exhausting and painful work. And again, it's not just the type of work, it's not just the actual physical work we do, it's the amount of emotion that we deal with every day that is sometimes so overwhelming for every one of us. And don't tell me you don't feel it. It's so incredibly important that we put effort, 15 minutes effort for us to calm down and reflect on what we do. Remember we said about the mindset, to understand the values of what we do. So when we see a difficult situation, like a difficult patient, when we reflect on that situation, we say, it's not about the difficult patient. It's not difficult. I can handle it. You reflect on the values and the things that we do here, and you have time to do whether meditation or yoga or whatever practices that you believe. And even if you're religious, you can pray. I think praying, if you think about it, is sort of a meditation. It's the practice of your mind. So I think the best thing to do is to have 15 minutes time, and when you get to the top, I want you to reflect that to the top higher left, to have 15 minutes time as a reflection time.